Welcome to this podcast from Neurogastroenterology and Motility. It publishes original research and topical reviews on basic and clinical aspects of gastrointestinal sensation and motility, as well as brain-gut interactions.
So welcome everyone to this month's podcast from Neurogastroenterology and Motility. My name's Adam Farmer and I'm a gastroenterologist at the Wingate Institute of Neurogastroenterology in London. This month it's my great pleasure to welcome Professor Sabine from the University of Lyon in France. Sabine's one of the pioneers of high-resolution manometry in esophageal disorders. So Sabine, many thanks for joining us on this month's podcast, and congratulations to you and your co-authors on your paper entitled Rapid Drink Challenge Test During Esophageal High-Resolution Manometry in Patients with Esophago-Gastric Junction Outflow Obstruction. So perhaps just if we could start by, if you could just give some background to high-resolution manometry, particularly perhaps for some of our fellows who are listening.
So thank you very much, Adam, for this invitation, and it's really my pleasure to contribute to this podcast. So as many of you know, the high-resolution manometry was developed at the end of the 90s, and it is now indicated to assess the esophageal motility disorders, and we are using a transnasal catheter to record the pressure variation along the esophagus, and this pressure variation are displayed as topography plots. High-resolution manometry is easier to perform than conventional manometry, and esophageal motility disorder are more likely diagnosed with HRM than with conventional manometry. So as a consequence, now high-resolution manometry is really the gold standard to assess esophageal motility disorders.
So could you just let me know what the Sheikah classification is of in esophageal manometry?
So the Sheikah classification is the classification of esophageal motility disorders using HRM. The first iteration of this classification was published in 2009, and since then it is regularly updated. The latest version was published in 2015. This is a version 3.0, and this classification is largely admitted all over the world, and it provides a common definition of esophageal motility disorders.
So what are the symptoms and causes of esophago-gastric outflow obstruction?
So EGJ outflow obstruction is usually associated with dysphagia and in some instances with regurgitation. The definition is actually an impaired relaxation of the EGJ, and we have also some instances of normal esophageal contraction. This disorder can be idiopathic, but it can be also an incomplete form of achalasia. It might be secondary to previous surgery. Esophago-gastric surgery included anti-reflux surgery. We may have some infiltrative process of the EGJ, some eosinophilic esophagitis or hiatal hernia, which can induce some level of obstruction at the level of the EGJ. Some recent data also suggest that treatment with opiates can induce an impairment of EGJ relaxation. So when we have a patient with this disorder of obstruction, we need to perform complementary examination to understand the disorder and to search for a cause of this disorder. But it's important to note that actually the majority of patients with EGJ outflow obstruction has a benign evolution, and most of them will not require any treatment at all.
Can you tell me what the Rapid Drink Challenge Test is?
So this test is a very easy test to perform during an esophageal manometry. It consists of drinking 1 glass of water as fast as possible in sitting position. So the intent is to perform a challenge to depict an obstruction at the level of the EGJ, and if we observe some pressurization in the esophagus, it might be the sign of an obstruction at the level of the EGJ.
So what was your study hypothesis?
So, as I explained, EGG outflow obstruction is an heterogeneous disorder with different conditions that might induce this disorder, and most actually of the patients have really a benign evolution and do not require any treatment. So, our hypothesis was that the drink challenge test might help us to identify the cause of EGG obstruction, if any, and also to identify the patient we might require a treatment.
So what was your patient population in your study and what methods did you use?
So among the 3,050 manometry we performed from 2012 to 2017, we selected patients with EGG outflow obstruction according to the criteria of the Sheikah classification, the version 3. The HRM studies were retrospectively reviewed, and the occurrence of pressurization and esophageal shortening during the rapid drink challenge test was evaluated. We also review all the charts of the patient to determine the cause of EGG obstruction and also to evaluate the results of complementary examination and the response to treatment, if any, in our patient.
So in your patient group, what were the causes of outflow obstruction that you identified?
So in our series of 75 patients with EGG outflow obstruction, the main cause of obstruction was a previous history of esophago-gastric surgery and mainly anteroreflex surgery and gastric lap band. We had 5 patients with an incomplete form of achalasia and 5 patients with a mediastinal neoplasia. And finally, last but not least, 25% of patients do not have any identified or an cause of EGG obstruction.
What were your key results to emanate from your study?
So the occurrence of pressurization during the rapid drink challenge test was associated with more severe dysphagia in our series of patients, but not with a specific cause of obstruction. Interestingly, the occurrence of esophageal shortening during the rapid drink challenge test was more likely associated with a definitive finding of obstruction, that is a previous surgery, a neoplasia, or an achalasia.
What were the limitations of your study?
So this study is a retrospective study, and it was conducted in one single center. So we did not apply a standardized protocol of complementary examination in our patient, so some cause can be missed in some patients. There is also a significant number of patients who were lost to follow-up, so these patients were classified as an undetermined cause of EGG obstruction, but actually we can have misclassified this patient due to the fact that we do not have any workup data available for them.
So what are the potential implications of the results from your study, particularly with respect to patient management, because often these patients are quite difficult to manage effectively?
Actually, our study really demonstrates that the occurrence of some abnormalities during the rapid drink challenge test, which again is very easy to perform, might really help us to manage our patient, especially if we have a pressurization during this test. It's associated with more severe symptoms, and it can be an indication of treatment in this patient. The other important finding is that the shortening was always associated with a specific cause. It was previous surgery, achalasia, or neoplasia. So if we observe an esophageal shortening during the HRM, we should advise an extensive workup to find a cause and to treat the cause of the obstruction.
So how do your results take the field forward now, and in your view, Sabine, what are the key knowledge gaps that we need to look at in future?
So one of the problems we have now with HRM is that unfortunately HRM might be not sufficient to diagnose all significant motor disorder, and we may have some false negatives. So we need to perform sometimes other tests. The good thing with all these challenge tests, including the rapid drink challenge test, but we can use also meal test, for example, is that they are very easy to perform. They did not require any specific equipment, and they are more physiological than what we are doing now during the manometry, that are the 5 millimeter water swallow in supine position. So if we are performing this challenge test, we may have some relevant information for our patient, and again, this is very easy to perform, and it might really help us in difficult cases.
So with that, Sabine, I'd like to thank you and your co-authors for a really excellent paper this month, and also assisting in this month's podcast, and also to our listeners for tuning in. I look forward to welcoming you all again on another instalment next month.
Further information about this paper can be found on the journal website. We hope that you have enjoyed this podcast, and we look forward to welcoming you to next month's edition.